further irritate your skin and exacerbate breakouts. A medical-grade topical treatment may also be needed to help clear blemishes. Wash breakout-prone skin twice a day with a mild cleanser. Look for oil-free, non-comedogenic and hypoallergenic cleansers formulated for acne-prone skin. Wash never strips skin of its natural oils, so moisturize daily with a lightweight, oil-free moisturizer to keep skin hydrated without clogging pores. Use over-the-counter topical treatments containing benzoyl peroxide, salicylic acid, alpha-hydroxy acids or tea tree oil. Benzoyl peroxide helps fight bacteria, reduce inflammation and unclog pores. Salicylic acid exfoliates skin and removes dead skin cells. Tea tree oil possesses natural antimicrobial properties while AHAs improve skin smoothness. Patch test any new product for at least a week to ensure irritation does not occur. Apply a targeted treatment with higher concentrations of the ingredient that works best for your breakouts, such as BP creams, salicylic acid toners or glycolic peels. Higher concentrations are needed to gain effective control of breakouts. According to your skin's needs, use treatments daily, 2 to 3 times a week, or limit to spot treatment of blemishes. Be consistent to see improvement. See a dermatologist for prescription medication if OTC treatments are not controlling breakouts. Options include topical retinoids, antibiotics, isotretinoin, as well as corticosteroid injections or light/laser therapy. Isotretinoin is very effective, but high-dose pills can cause side effects, so risk factors should be considered before use. Moisturize daily and use oil control blotting sheets when needed to prevent breakouts from excess oil. Look for oil-free, non-comedogenic mattifying formulas that do not clog pores. Use oil-absorbing sheets instead of powders, which can irritate sensitive skin. Only blot oily areas to avoid further irritation. Wash pillowcases, towels, and any other items that come into contact with your breakout-prone skin regularly on a weekly cycle using hot, soapy water to prevent retransferring oil. Dirt and bacteria to skin. This can help control breakouts and prevent new ones from forming. With consistent treatment, patience, and moisture balance, breakout-prone skin can achieve clearer skin. Be careful not to overdry or overcleanse skin, which will only lead to more breakouts. Staying committed to a routine and products targeted to breakout skin will pay off. Breakouts tend to reduce slowly, so continue good habits and treatment for best results. If you have acne-prone skin, it can be difficult to find the right products to help keep your skin looking and feeling its best. Here's a guide to finding the right products for acne-prone skin. First, make sure to cleanse your skin. Choose a gentle cleanser that won't strip your skin of its natural oils, and make sure to use lukewarm water. Next, use a toner. Toners help to remove any excess dirt and oil and can help to balance your skin's pH level.